can MCT oil help or harm a fatty liver? This video is for general information only and is not a substitute for medical advice. Always speak to your healthcare professional about your individual situation. Are you wondering whether MCT oil could make a difference to a fatty liver? Let's look at what the evidence actually says. Fatty liver disease is incredibly common. It affects up to 30% of adults in the UK, and it's closely linked to obesity, type 2 diabetes, and metabolic syndrome. So it's no surprise people are searching for ways to support their liver health. MCT oil stands for medium chain triglyceride oil. It's a dietary supplement usually derived from coconut or palm kernel oil. What makes it different from other fats is how your body processes it. The fatty acids in MCT oil, particularly C8 and C10, are absorbed quickly and sent straight to the liver, where they're predominantly used for energy rather than stored as fat. That's the mechanism that sparked interest in whether MCT oil might help reduce liver fat. But here's the important part. There is currently no established evidence that MCT oil treats or prevents fatty liver disease. In the UK, it's regulated as a food supplement under food law, not as a licensed medicine. It has no MHRA-approved medicinal indication for liver conditions. So while the science behind how it's metabolized is genuinely interesting, that doesn't automatically translate into a proven benefit for your liver. If you're considering MCT oil, it's also worth knowing that it's quite energy dense, around 115 kilocalories per tablespoon. If you're managing your weight as part of looking after your liver, that's something to factor in. In terms of side effects, the most commonly reported ones are gastrointestinal, things like diarrhea, bloating, nausea, and abdominal cramping, particularly if the dose is increased too quickly. There are also some groups who should be especially cautious. If you have decompensated cirrhosis, severe liver impairment, or diabetes managed with insulin or sulfonylureas, please speak to your GP or hepatologist before trying MCT oil. If you're pregnant or breastfeeding, speak to your GP or pharmacist before using it. And anyone with a coconut allergy should avoid it altogether. So what does actually work for fatty liver disease? The evidence here is much clearer. Lifestyle modification is the cornerstone of NAFLD management, and it's backed by NICE guidelines. Gradual weight loss, even a modest amount, can meaningfully reduce liver fat. A Mediterranean-style diet rich in vegetables, whole grains, healthy fats, and lean protein is well supported. And around 150 minutes of moderate aerobic exercise per week is recommended. It's also worth noting that crash dieting can actually worsen liver inflammation, so slow and steady really does matter here. If you have fatty liver disease and you're thinking about adding MCT oil or any supplement to your routine, please bring it up with your doctor first. They can look at your full picture, your medications, your liver function, your overall health, and help you make an informed decision. Keep an eye out for symptoms that need prompt attention. If you notice persistent fatigue, pain in the upper right side of your abdomen, or abnormal liver function test results, contact your GP. And if you develop jaundice, yellowing of the skin or eyes, confusion or vomit blood, call 999 or attend A&E immediately. If you think a supplement has caused a side effect, you can report it through the MHRA Yellow Card scheme at yellowcard.mhra.gov.uk. So to recap, MCT oil is metabolized differently from other fats, and that sparked scientific curiosity, but there's no established evidence it treats or prevents fatty liver disease. It's a food supplement, not a medicine, and it does carry side effects and contraindications worth knowing about. The most evidence-backed approach to managing NAFLD remains lifestyle change, gradual weight loss, a Mediterranean-style diet, and regular exercise. Have you got questions about supplements and liver health? Drop them in the comments below. We'd love to hear from you. And if you found this helpful, please give it a like and subscribe to the Bolt Pharmacy channel for more medically reviewed health content.